So-called end-of-life language in the House bill. Joining me now from his home state of Michigan, Congressman Thad McCotter. Hello, Congressman. Good to see you. Some people are really worried about what they perceive to be the so-called end-of-language language that's in the end-of-life language that's in this House bill. Where is that exactly? Is it real? Is it something to be concerned about?
End-of-life provisions, Brian, are not per se something that people tend to object to. If they're in the proper context of a compassionate bill that empowers patients, that leads to the increase in supply of health care, these are places that these provisions would be acceptable to many of us. But when you put it in the context of a government-run rationing bill, that is a place where we do not think it is appropriate to put an end-of-life provision, because down the road you can see where the misuses of that could occur. Now, supporters of the provision in the current bill, including something called Compassion and Choices, the former Hemlock Society, would argue with that. But what I would say is, if you take that provision out and deal with it as a separate piece of legislation, you could avoid many of the concerns that people have. You could still have the end-of-life provision properly done. But putting it in a government-run rationing bill is not the place to do this.
You know, Congressman Jack Murtha has been heard on a local radio station up in Pennsylvania saying he doesn't know that they can get a deal this year. Where do you think it stands?
I think the American public knows that the healthcare system has problems. They are concerned. It's an issue to them. What we have to do, Brian, is get past the rhetoric that the entire system is broken and get down to the realization that there are things people like about their healthcare they want to see conserved. They have a compassion for people who are underserved, and come from the center and build out. Now, Mr. Murtha and others, we are waiting as Republicans. We are more than happy to engage this from the center on a bill that will actually help address some of these key reforms. But the decision has to be made, because we're witnessing a debate internally amongst the Democratic Party about a bill that they do not have unanimity on, and that is the question that's occurring right now, is will they come back, try to rush it despite the wishes of the American people on a bill from the left of their party, or will they come back, start in the center, and work with those of us willing to try to accomplish something?
You know, some of these town hall meetings have been rather contentious. Have you had a town hall meeting, and how have they gone?
We've done telephone town hall meetings on the specific issue of health care. I've been continuing to run around my district, as is my job as a servant of the people, to get their input. My concern with the town halls is what we're seeing, especially with the media attention, is you will attract vehement supporters of the bill, vehement opponents of the bill, and normal people will sit home and say, I don't want to be part of that political circus. It will not help to inform me. The key thing for people to do, and I continue to say this even as an opponent of the bill, is go online at the Energy and Commerce Committee, download it, take the time to read it, and see how it affects you, and then make your voice heard one way or the other in a clear and concise fashion.
All right, Congressman Thaddeus McCotter, it's always good to have you on our show. And